Hi, we are the Platform of Hope. The Platform of Hope initiative was founded by 4 anchor institutions, Mary Center, Jubilee Housing, Jubilee Jumpstart, and Sitar Art Center in 2018 to support low-income families of color in Ward 1, Washington, D.C., in response to the displacement of Black and Brown families from our city. As you may have read, DC had the highest rate of gentrification in the country during 2000 and 2010, directly leading to the displacement of 20,000 Black residents from the district. In response, the Platform of Hope initiative was launched in September 2018 as a pilot program that would work with cohorts of 20 families throughout a 12-month program year, with the goal of reaching 100 families over 5 years. POH deeply focuses on supporting families in obtaining their goals, streamlining access to social services, and deepening connections in our community. Our founding goals are to confront inequity, center families, be responsive and transparent.
In the Platform of Hope, our participants decide what they want to work on and how they define success. Our model sees growth in social capital, something made harder by social distancing and quarantine, as a key indicator for success as families connect with one another to pursue goals and identify shared solutions. Here's some ways that we measure this. POH supports families in identifying and pursuing their goals across housing, education, health, employment, and finances, with the understanding that these are intersecting issues that are too often siloed and made more inequitable. Here's an example of a radar chart we use with families to track their goals and to start to see progress towards actual change in their life. Note that families are defining what they see as their goals and even what categories they wish to address. Through our family-centered coaching, participants create strategy plans with POH staff and on a monthly basis, check in for support on pursuing these strategies.
In our 2018-2019 pilot year, our cohort A families cumulatively made progress towards all their identified goals, most notably debts, savings, and health. 2 years later, and we see the need for this interconnected model more urgent than ever before, as the existing racial disparities in health, education, housing, safety, etc., have widened by the pandemic. We've all seen that when one of these categories collapses, public health, for example, everything collapses: education, employment, housing, and more. Our radar charts show the deep difference between year 1 and year 2 of the program, particularly for cohort A families who began in September 2018 and cohort B families who began in September 2019. You can see how little progress was made and in fact how certain categories saw regression, such as the 27% decrease in mental health for cohort B families from 2019 to 2020.
The special ingredient in this family-centered work is in building social capital amongst families, so as to create strong social networks and collective power. We track the formations of social networks between cohorts, asking families every 6 months, who could you go to for help? Not who do you just know, but who is a resource for you? This is based in our belief that families are innately resourceful and creative, and that their lived experience is an important resource. As you can see, each year we've seen these social networks blossom, from 73% growth in year 1 for cohort A to a 93% growth for cohort B, made more impressive because that was all during social distancing and on Zoom.
Towards centering family voice and being transparent, our planning committee of family plans our signature family Saturdays, third Saturdays of the month. And through quarterly journal entries, we collect suggestions from all families on programs that we can offer. As we tell the families, you are our bosses. To ensure this ownership is embedded in our organization, we recently expanded our leadership body from the steering committee, comprised of our strategic alliance partners, to an advisory board with our 4 EDs, 6 POH family representatives, and 4 volunteers, purposely putting families in the majority.
We're eagerly exploring ways that nonprofits can act more collaboratively across fields and center families in programmatic, organizational, and systemic change. How do we break the nonprofit model where decisions are made by those the least impacted? And how do we upend patriarchal decisions and perspectives so that participants feel valued and empowered? And most importantly, how do we not just improve the lives of the families that we engage through our programs, but change the systems that impact everyone? Some things that we've learned. Collaboration. Openly admit that all of these different efforts are needed. No one is more important than the other. Don't be pitted against each other. Solidarity is important. Family-centered. If we are not listening and responding to what families need, we are repeating the same inequitable patterns. Direct service versus advocacy. Most organizations are expected to do one or the other. How do we change this paradigm to truly move the needle? Thanks so much for learning about the Platform of Hope. We hope you will chat with us on May 3rd as part of the conference. Here are some prompts to lead the conversation. And here are some readings that we've been inspired by that you should check out. And last but not least, here are some ways that you can learn more about the Platform of Hope. Thanks so much.